long-term health benefits in terms of sleep and cardiovascular health and mental health come from wearing the wearable, and wearing it, for most people wear it 20, almost all day except when they shower, and then have it turn on automatically about 3 to 6 hours.
That is incredible. And I'm similar to you, Dave, going on stage. As you said, most people probably wouldn't guess it at least when after your first minute or so, but holy cow, I'm thinking every negative thought you could think of, but if you could use that positive, or you could use that energy into harnessing your craft, wow, that's powerful. And as I said, I love this idea of being able to use non-pharmacologic, your phone, which we all are possessing, plus minus a wearable, to be able to help achieve that. Like, this is gold. So I'm wondering, like, are there any other clinical applications that are on the horizon? Because I gotta say, when I chatted with you at Eudaimonia, there was a half a dozen ideas I was thinking about in terms of areas that they could apply to, just off the top of my head, like clinician wellness, kids that are maybe that are ADHD or overactive, or like kids on the spectrum or adults on the spectrum. Like there's just all these kind of like fight or flight conditions that a lot of our population is experiencing. So yeah, what's on the horizon?
Well, we have, so Apollo, since 2018, we have 17 completed clinical studies, and we have 12 more studies ongoing. The completed studies that have shown really great success, some of which I mentioned are, and they're all like in the peer-reviewed publication pipeline now, but that's like PTSD, sleep, fatigue in metastatic cancer patients, fatigue, and we had this really interesting study in another population, folks who have cancer, who have gone through cancer treatment especially, and folks who have severe autoimmune disorder are known to have major disturbances in their autonomic nervous system. And that what we were talking about, this vagal parasympathetic and sympathetic fight or flight stress response system. The folks with these conditions, many people don't think about this way, but they're known to have disturbances that are pretty significant in those systems. So we thought, well, what if we gave people a little bit more vagal tone throughout the day, right? Would that help relieve some of their symptoms? So interestingly enough, in the autoimmune study, we saw not only improvement in Raynaud's phenomena. The autoimmune study was scleroderma, systemic sclerosis. Like basically a terminal autoimmune disease that's horrific. And we saw improvement in Raynaud phenomena. So increased blood flow to the peripheral vasculature in the fingers and toes, less Raynaud symptoms across 4 weeks. And then we also, I think it was 4 to 8 weeks. And then we saw improvement in sleep, improvement in mood, improvement in stress, improvement in quality of life, and trending improvement in pain. All the others except pain were very statistically significant in a group of 30 people tracked over 4 to 8 weeks. So when you think about that, all of those things that I just mentioned, the sleep, the anxiety, the stress, the low mood, the fatigue, right? These are all things that would typically these patients would be given prescriptions to address individually, generally speaking, right? Each one of those things would have its own prescription.